I'm Swapnil Hiremath. I'm a nephrologist from the University of Ottawa in Canada. And our special guest today is Dr. Niteesh Choudhry.
Thanks for having me. I am a professor of medicine at Harvard Medical School and the Harvard School of Public Health. I'm an internal medicine general internist hospitalist by clinical practice.
So the question here is, how do we diagnose it, right? How should we be thinking about non-adherence in this setting?
As far as diagnosing it goes, this is actually harder than it should be. The basic behavior, so to speak, we're trying to identify is not taking medications as agreed upon. But the ways that we then have to measure it really in broad terms get broken down into things we can ask of patients or subjective things and things that we can objectively measure. And self-reported measures, if you look across the literature, tend to vastly overestimate adherence. Conversely, if someone says they're non-adherent, they probably are non-adherent. So you should clearly believe that. In the objective measures, there's a range of things ranging from drug levels to pill counts to using electronic data from health insurance claims. And those tend to be more accurate, but even they have their problems. What we have available to us as frontline clinicians is slightly different than what's available as health systems. And so we are left asking questions. And as long as we ask questions appropriately and respectfully, that's the best that we can do. But increasingly, we have access to some of these electronic records, electronic filling data in our health systems as well.
The normalizing non-adherence, that's a really fundamentally useful statement. Often we ask the patient, are you taking your pills? Someone mentioned to me that a better way of framing it is, how often do you forget your pills? So that normalizes the behavior that it's common.
I love that point, and I love that idea. Usually we start with something which normalizes it even more, obviously, as it taking medications can be very hard. Many people don't like to do it. And in a given week, how many times might you forget? What I would add is that there are distinct patterns of adherence. And sort of we have done large-scale studies looking at how adherence changes over time. It's not a one and done conversation. So some people are adherent, they begin their medications and they remain adherent. Other people are adherent for some period of time and then they discontinue medications. Other people become erratic and then something happens and they resume taking again. There's these very distinct trajectories of medication adherence, which large studies run by my group and many others have demonstrated. And so we ask about adherence episodically, but it's important to continue to ask about adherence at every one of those follow-up visits just to immunize against future non-adherence.